Hello everyone, my name is Dr. Jigna Shah. I'm a board certified psychiatrist and I'm also certified mindfulness teacher. Today's my topic is mindfulness in a chronic illness for wellness. Now, before I start on the topic, let me thank DFIT MSA organization for inviting me again this year to talk about mindfulness that I really enjoy teaching healthcare professional as well as others for stress reduction, stress management, wellness, and resilience. I am delighted to share my experience and knowledge about mindfulness practice with global MSA community. So, chronic illness, according to current analysis, half of the US population lives with chronic illness, either one illness or maybe more. About 28 to 30% of population has more than two chronic illness. Person dealing with chronic illness and their caretakers face many more challenges than healthy people. They have increased life challenges, chronic stress. Although some stress helps you to adapt to the situation faster and help you to deal with the challenges, but when it gets prolonged, it may cause burnout. Caretakers for the chronic illness patient also feel burnout. If you can avoid stress, that is the best, but in this age and days, uh, to find a stress-free life is almost impossible. So what best we can do is to manage the stress. And if we don't manage the stress, it affects the perspective of life, our energy level, motivation, and influence our commitment to the self-care. It exacerbates the illness that you already have and also affect other systems in your health. It decreases the quality of life. It affect your wellness. Now, talking about the wellness, let me talk a little bit about what wellness means to the person who is struggling with the chronic illness. Because wellness, people use many times, people use it interchangeably with the health. But wellness goes beyond physical and mental health. Wellness, it is really the balance of all aspect of your life. It's multidimensional. It involves the physical, mental health, emotional, social, spiritual, environmental, your leisure time, your hobbies, and whatnot. So it's basically a state of being in a balance of all aspect of the life. And despite all the challenges and the struggle, the goal for wellness for people who are dealing with chronic illness is not different than people who don't have any chronic illness. Because wellness is an active process for everyone. Everyone can participate to promote their own wellness, regardless of whether they have any chronic symptoms or not. It's a process of being aware that helps you make the choices to sustain and enhance the quality of your life within the context of your chronic illness and disabilities. There are many resources and techniques available to manage your stress and promote wellness, and mindfulness is one of them. In recently, in this age and days, in last few years actually, the popularity of mindfulness has surged given the considerable evidence that it reduces the subjective measures of the stress. It's a simple and easy technique. Um, and when I say easy, it's not that easy when you start doing it, but it's very simple to understand. And if you follow, it can get easy. For people dealing with the chronic illness, it is well suited as a complementary to their standard of care, traditional allopathic medicine, as it given that the mindfulness increase your self-awareness. So let me go on talking about mindfulness, what mindfulness is, and how we can cultivate this self-awareness that helps you to promote your own wellness. So mindfulness, before I go talk about what mindfulness is, I will just briefly talk about the history of it, it is based on mindfulness, is based on practices of mindfulness, is based on ancient philosophy. It has been going on for thousands of years around the world. The concept was introduced to the Western world by professor named John Kabat-Zinn in 1970s. What he did was that he secularized this practice by untangling the ideology and religious aspect of it. So now we have this modern mindfulness-based intervention, which is offered in many clinics, hospitals, many organizations, which is not religion-based. Um, how he defined mindfulness is that it is an awareness that is cultivated by paying attention on a purpose in a present moment non-judgmentally. Let me again repeat this definition because it has many components. It's an awareness cultivated by paying attention on a purpose in a present moment non-judgmentally. So many leaders around the world define the mindfulness in a many different ways, but the message is same. If I can put it in a simple uh, statement, I would say this, that mindfulness is awareness of a present moment experience with acceptance. It's an awareness of each moment to moment experiences. It's a dynamic process, whatever is happening. There is an awareness of those experiences with acceptance. Now, when it comes to the acceptance, someone may say that, why would I accept something which is not right, or something I don't like, or something that is, I didn't do it anything, or no, why do I take it because somebody else did something? So, what it means, let me clarify this, that acceptance in mindfulness is trying to see the situation as it is now without adding your own judgment, assumption, or interpretation to it. It does not mean that you are approving or resigning from it. It means that you are recognizing that with mindful awareness. And this awareness means that you are, again, you are not adding your own judgment or assumption to what you are observing. And when you observe your present moment experience with this clarity and equanimity, it enables more appraisal, more effective appraisal of your stressors, which in turn help you to respond rather than react. That sometimes you react to the things later on when you think or when you reflect on it, you realize that it was your judgment, or you reacted to the something which was not, you could have done differently. So that's what the mindfulness awareness is, that you observe with that awareness, accept it without adding your own interpretation, judgment, assumption, biases. uh, and when you do that, you can effectively appraise your stressors or situation, and you can respond rather than react. I'm sorry, you can respond better. So important thing is, how can we cultivate this awareness? People may say that, oh, I am aware of moment to moment what is happening in my life. uh, Everybody has the five senses that they use. They see, they smell, they um, have all those experiences they can see, they can experience. But how you can develop this awareness that helps you see it more clearly? So it is an experiential learning. It's like learning music. You have all the notes, but you cannot sing. You have to practice. That's the same way this mindfulness also. You have to practice it. You have to do it regularly. It's like going to the gym. If you want to get fit, by reading a book or understanding that, okay, this is how you do it, you don't get fit. You actually have to do it. So it requires some commitment, effort, and regular practice. And what kind of practices you can do. What these practices means. There are formal and informal practices. Formal practice, informal practice, intentionally you commit few minutes of your time and dwell into the silence and focus on a chosen object. Uh, it could be breathing, it could be body sensation, or it could be slowly walking. So when you are doing this formally, sitting and focusing, if you choose to focus on your breathing, every time your mind wander, you notice that without any judgment, interpretation, analysis, um, and and come back to your breathing. Every time your mind wanders, which it would wander, because that's a normal thing. Everybody's mind wander. Half of the time, our mind wanders. So when you notice that mind is wandering, you bring your mind back to the breathing. When you do that, you will see the impermanent nature of your thoughts, feelings, and whatever else is happening in your mind at the time. You can train your mind to focus on the things that you want to focus. Uh, so that's when you do it with the breathing, you focus on a breathing sensation, physical sensation of the breathing, either wherever you feel your breath most predominant. It could be your chest, belly, or at your nostrils. When you If you choose to do the body sensation, it's called body scan practice, which is very effective practice. You can take a few minutes of your time and sit quietly in a place, or you can even lay down and focus on each part of the body. You can start from your feet, or you can start from wherever you like to, and you feel if there is any sensation. If there is any sensation there, rather than saying that there is a pain, oh, it is so annoying, or I don't like it, you just name it. You give it whatever you are feeling. Like you go to the doctor and describe your pain, that it is tingling, numbness, tightness, pressure, dull. You see that what kind of sensation you are feeling, and you give it a name. You see that whether there is any emotion attached to it. Is your mind is taking you to any storyline around that sensation? Is the intensity changing with moment to moment? What else is happening? And you stay with that sensation for a minute, whether you like it or not like it. If you pass your judgment that with, oh, I don't like it, why do I have to sit with that, you also notice that, and then you move on to the different part of the body. um, so that's a body scan. In a walking, you can find a spot to walk where there is not too much stimulation, a relatively quiet place where you can walk very slowly and focus on the walking sensation, focus on the motion of the body, how your joint moves, and how what you observe. So those are the formal practices, and it helps to train your mind. And you can see that every time you try to do this practice, what kind of experiences you have, your mind wanders, and you can bring back. And when you bring back, you have one thought, then you have another thought. Your mind is going on roller coaster. So there are different experiences you can see while doing this practice. Basically, you will be able to see your pattern of your mind. And there are informal practices. Informal practices are, you what you do is you weave this mindful awareness to your daily activity by simply noticing whatever activity you are doing in the moment. Because when we are doing the routine activity in a day, like brushing your teeth or showering, uh, we know this activity well. Our mind goes on planning the day, meeting, this, that, future event, past. So you are not basically with that activity. Your mind is not in the moment. So you notice that and bring your mind back to whatever you are doing. If you're brushing your teeth, you are taking shower, or you are working in a kitchen, peeling vegetable, how it feels, what you are doing. It's not your analysis, interpretation. It's just the experience of that particular activity. uh, if your mind is consumed with the thoughts, you can help yourself to bring back in the moment by grounding exercise. Grounding exercise, you can use the five senses. uh, what you see around yourself, 5 objects that you see, what you hear, what kind of sound you hear, rather than defining that sound with your interpretation, just the what sound actually is, just the observation. Stay with the fact. You notice if you are making your interpretation, you also notice that and bring it back to what you are doing at that time, or what you are hearing. Touch, smell, taste. You can use any of the sensation to do this grounding exercise and bring yourself back into the moment. And this particular exercise does work when your mind is consumed, uh, when you are consumed with some kind of thoughts, or you are obsessing or ruminating on something. It is sometimes when you are gripped by those thoughts and you have a hard time letting it go. So that way you can bring yourself back into this moment. Your mind may go back to that thoughts again, and you can do this again, and that's how it helps you to train your mind. Now, how does this mindfulness work? So as I said before, it helps you see your mind's pattern, so you can catch yourself when you are obsessing with any thoughts or ruminating on thoughts, and you can shift your focus before you go on that storyline or that fantasy quite far. And you know, before we react, before we any behavior or we speak, there are thoughts. Thoughts becomes words, words become deeds, deeds become habit, habit become character, and character become destiny. So here you have, with this mindfulness awareness, you have a chance to catch yourself and shift your focus. It also, the mindfulness practice also helps you calm your mind, help you see the impermanent nature of the thoughts and feelings. Thoughts are not facts. Thoughts is just the production of your mind at the moment. If you don't entangle, it helps you not to get entangled with those thoughts. So you can let them go easily. So doing this practice, you will see that mindfulness may not take away, it will not take away the stress or the challenges that you have, but it will definitely change how you engage with it. So you have a chance to respond rather than react. Now, let me first talk about what does mindfulness in chronic illness means. So when you are suffering from chronic illness and have a chronic symptoms, that's the last thing you want to focus on the present moment, because you may be having those symptoms or having that obsession with the illness or dreading for the future. But mindfulness, focusing on the moment with mindfulness awareness, uh, help you to have that deeper sense of balance. It help you manage the negative part of it and amplifying the positive aspect of your life. Because when you have a chronic illness, it's a constant companion, constant stress, and you easily lose the sight of the positive aspect of your life. And many times you start defining yourself with the illness, but you are not your illness, you are not your thoughts. You can reclaim your unique character and find the things that brings the joy to your life. It helps you to be present with the turn that your life has taken, and the from what you have planned before the illness mm, came to you. And it can help you find the ways to thrive with the illness. And when you sit in the moment with the mindfulness awareness, it helps you see many small and large things to be thankful for, no matter what is going on in the life. You begin to experience more and more gratitude and compassion for yourself and others. And that shift your total well-being. And research has shown that by doing this practice, mindfulness-based intervention leads to measurable changes in the brain region, which is involved in memory, learning, and emotions. So there are plenty of evidence for that. And before I conclude my talk and finish my talk, let me just briefly say what mindfulness is not. Mindfulness is not a religious practice, as I said before. It's not a mind trick. It is not about suppressing and stopping the thoughts or emptying the mind. It is a dynamic process where you observe everything that is happening with the clarity and equanimity. So you can appraise your stress or situation better. There are many mindfulness-based intervention available, different type of mindfulness-based intervention, different intensity available in a clinic, hospital, You can check with your treatment provider if you want to learn more, and always practice it within your tolerance. And if you're struggling with any mental issues or any intrusive thought, seek counseling. Ask about mindfulness based intervention. Nothing is without risk, and mindfulness practices is no exception. There are three key dimensions to the safe practice: the intensity of practice, quality of instruction, and vulnerability of person. So you can check with your treatment provider. And thank you for listening to my talk. Before I end this talk, we will have a few minute practice that is with the recorded practice. So thank you, and if you wish to join, you can join to this practice and experience the short practice of mindfulness breathing. Thank you. When you are ready, sit comfortably. Close your eyes if possible. Bring your awareness in a space around you. Feel your body there. If you are feeling any tension, see if you can let it go and relax. Having any thoughts and feelings right now? Simply notice them without any judgment. No need to hold on or push them away. Let them float by. Having any sensation in a body around you? Notice them. No need to struggle with what is already here. Now bring your attention to breathing. Continue to breathe as you are. No need to change it. And be with your breathing. Feel how air is moving in and out. Feel rise and fall of your chest with each breath. If your mind has wandered off by now, it's okay. Just notice where it went without judging. And kindly bring your attention back to breathing. Now expand your awareness to whole body and feel as your whole body is breathing. Having any thoughts, feelings, sensations, hold them in awareness as well, just as they are. When you are ready, open your eyes and take this sense of awareness with you for rest of your day. Thank you and have a blessed day.